Let's talk about some frequently asked questions in the field of limb lengthening. I get these questions quite regularly, and they often crop up in email consultations or online consultations with patients. The first question I get is, what is a safe amount to lengthen? Now, this is a question that comes with a lot of baggage because depending on where your starting height is, you would probably want to max out the amount of lengthening you get. Of course, we all know that lengthening limbs beyond a certain limit becomes unsafe. And there's a saying in our field that the first 3 centimeters is free, and after that you start getting your complications. So generally, for a femoral lengthening, if you ask me what is safe, my answer would almost always be intramedullary nail lengthening at a limit of about 6.5 centimeters. Can we go more? Of course, in some instances we can stretch that even more. Most nails now allow 8 centimeters of lengthening, but for the majority of patients, the sweet spot risk-benefit ratio is around 6.5 centimeters in the femur. Now in the tibia, it's a little bit different. In the tibia or the lower leg, we obviously have the fibula to contend with. So there's 2 bones that we need to contend with. We also have things like the ankle joint and the Achilles tendons to contend with, which means that the safe limit in the tibia actually lowers down to about 4 or 4.5 centimeters, which means that if we do femurs and tibias, we can probably safely gain around 11 centimeters in height. That is a general ballpark, but of course it has to be tailored to each patient's individual physiology, anatomy, and journey. So we often embark on the journey, and then once we get to a certain target, we then have a discussion together to say, is it safe to go beyond this? And we sometimes then are able to push that limit a little bit.